Cases in the country have now hit the 700 mark after 28 more people tested positive, 9 of them truck drivers at the Namanga border with Tanzania. In the latest figures, 12 more people have been discharged, while one patient in Mombasa has succumbed to the disease. And as KTN senior reporter Rita Tinina tells us, the government has now reduced the cost of COVID-19 testing to 1,000 shillings to enable restaurants meet requirement of testing their staff.
On the 13th of March, Kenya confirmed its first COVID-19 case. 60 days later,
we have tested 841 samples, out of which 28 have tested positive for coronavirus.
COVID-19 cases now stand at 700. 12 more people have been discharged, increasing the number of recoveries to 251. One person has died, bringing to 33 the number of those who have succumbed to the disease. Of the 28 new cases, 10 are from Mombasa, 9 Kajiado, 7 Nairobi, and 2 from Wajir. The 9 cases in Kajiado are raising concern.
The 9 cases from Kajiado are all Kenyan truck drivers who are returning from Tanzania and tested at the Namanga border point.
On Sunday, the government announced measures aimed at containing the spread of the coronavirus through truck drivers, among them setting up testing centers along the transport corridors and designating checkpoints and hotels for truckers.
Especially at our border points, we are seeing increasing numbers of positive cases.
The government on the 27th of last month outlined measures for restaurants to comply with before being allowed to reopen, including placing tables 1.5 meters apart and having all employees tested for COVID-19. With the cost of testing restricting restaurants from reopening, the government has now reduced the cost.
The cost of tasting for the businesses will be 1,000 Kenya shillings.
The burden of inspection and compliance permit fees has also been lifted.
There'll be no charges for inspection, neither there'll be no charges also for the compliance permit.
One of the patients who lost their lives died in hospital. The Ministry of Health says it is working on guidelines that will require anyone admitted to a health facility to be tested for COVID-19.
And when people die at facility level, of course, then they put the healthcare workers at risk of contracting COVID-19 and, of course, also transmitting the infection to other patients who are in the ward.
As the country enters the 3rd month since its first COVID-19 case, the government's focus is to contain community spread of the virus. But with the country yet to flatten the curve, the number of COVID-19 cases will remain on an upward trend. Rita Tinina, KTN News.